Welcome to America's Heroes Group.
And welcome to America's Heroes Group. This week is our roundtable with our partner, Hines VA, Women's Healthcare. Today is Saturday, June 18th, 2022. And June, don't forget, is LGBTQ plus Pride Month. You just heard our host, Kelley. I'm Sean Claiborne, the co-host, National Guard veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a new person on line today. She's joining us, and she is Krystal Lynn Gilewski, a Hines VA licensed clinical social worker and Women's Veterans Program Manager. And we're going to talk about healthcare and the women's programs that are available at the Hines VA. Now, Krystal Lynn, she's a licensed clinical social worker. She's a psychotherapist with 11 years of experience, and also she specializes with women's issues, making sure that women, particularly veterans, feel safe and welcome at the VA. How you doing, Krystal?
I'm good. Thank you so much for having me. How are you doing today?
Pretty good, pretty good. So I'm glad to have you on with us. So we're going to talk about some things that have to do with women, in particular women's issues, joining the VA or getting involved with the VA health system. What are some of the things that are particularly unique to women's issues as far as joining the VA?
Some of the things that are unique to our women veterans are, one, the type of care and services that they need. And then also just the environment. The VA for so long has really just served the male population, and now, we're seeing an increase with our women veterans. I believe the VA serves about 9 million veterans total, 2 million of which are women veterans. And our women veteran population is expected to increase about 18,000 per year for the next 10 years. So the way we look at care and how we deliver care, we need to start shifting and really thinking from a woman veteran perspective.
That's interesting. So I remember reading something, some studies that were talking about how a lot of the research and treatments and things, not just in the VA system, but just across medical care in general, always looks at men, and even in the experiments that they do. Like, for example, there was actually a doctor that talked about the fact that they were doing treatments on drug treatments and are using male mice as opposed to, like, screening out for male mice as opposed to using male and female mice. Just doing drug studies, but the fact that women have different physiology rules out a whole bunch of missing information because they're not doing that kind of research.
Yes. Yep. And I will say, Hines, we do have a program. It's short for WORP, and I'll be honest with you, I can't remember exactly what it stands for. But the main focus of WORP is really to recruit some of our women veterans for these studies, because to your point, a lot of the medical studies have been on men, so we know what to do. But again, women veterans, we need them to participate. So, as they're coming in, we can tailor their treatment to their specific needs.
So what's the difference between the Women's Health Clinic and the Women's Veterans Program? If they do two different things, or how does that work together?
So, yes and no. So the Women's Health Clinic is part of the Women's Health Program. So a lot of folks use the two interchangeably, but the Women's Health Program is just more encompassing, because our Women's Health Program, it includes our Women's Health Clinic, and I can talk a little bit more about that as well, what that includes. But it also includes our community-based outpatient clinics. It also includes other parts of the hospital, our environmental care rounds, our outreach events, and then our collaborations with other service areas. So like our maternity care program, our intimate partner violence coordinator, our military sexual trauma. So it's just a little bit more encompassing, and the Women's Health Clinic is a part of that.
So what do you do to try to get more women veterans to take advantage of the Hines VA or the VA in general? What types of things that should women know about, particularly veterans, in order to get into this program?
Sure. So first and foremost, I will say any woman veteran who is listening right now, if you have questions, do not hesitate to call and reach out, and I will definitely speak more in depth. But in our clinic, we offer several services besides primary care. And I should also say, all our women's health primary care providers are trained in women's health issues, but they're also trained in women veterans health issues. And this is the same at each of our 6 community-based outpatient clinics, because we also realize that not all our women veterans live close to Hines. So we really want to make sure that they can at least have a primary care provider in their area. But in our clinic, we do offer gynecology, urogyne, we have a cardiologist, we offer mental health, and that is both therapy, short-term, long-term, and we also have psychiatry. We also have a dietitian, a pharmacist, we have social work, and then we also have a maternity care coordinator. And then, like I said before, we really have close partnerships with our military sexual trauma coordinator, our intimate partner violence coordinator, and just other services across the hospital. And so I think this, and again, I want to say thank you, giving me the opportunity to come and speak, because unfortunately, a lot of veterans, both male and female, have no idea we exist. And Hines in particular, we have a separate clinic just for our women veterans, and we're located on the 12th floor in our main building, our main tower.
So women want to get information, where should they contact you? Do you have a phone number you can give out, or a website we can go visit?
Oh, yes, absolutely. So I can give my phone number here. It's 708-202-2075. But if no one can remember that, you can always just call the main number and ask the operator to transfer them to me. And, if I'm not available for any reason, they can leave a message, and I'll definitely return their call. They can also go to our Facebook page or on the internet, Hines VA Hospital, and there's some information there as well.
So you're a psychotherapist, and so you have 11 years of experience in that field. What are some of the things, what's the most common thing that you see when you're treating patients?
So I will say in this current role, I'm not seeing patients clinically. More of my role is more program development, advocacy, and just really making sure that any gaps that we have, we're identifying those and working on them, and also improving our strengths. But I will say, from just working in the VA and with my collaborations, some of the issues I'm finding is, unfortunately, a lot of our women veterans don't identify themselves as veterans. They don't see themselves as veterans, and that's partly a barrier to care and why they're not coming in. The second is when they do come in for care, some of them are facing harassment, or they just don't feel like they're welcome or safe. And then some more on more of the mental health would probably be PTSD. So those are would probably be like the top 3 things that I've seen just from in my role as the program manager.
I think that's interesting. You mentioned that some women don't see themselves as veterans, although they wore the uniform. How is that? I don't understand how that.
I'll be honest. I'm not a veteran. I'm a civilian, so I don't want to speak as if I am a veteran. From the sense that I get from my interactions with women veterans, I think it's because while they were in the military, also they weren't, really seen and treated fairly. And so, a lot of them did their time, they served, and it's kind of like, I did what I need to do, I had that experience, and now I'm kind of done. Plus, just historically, the VA has served male veterans. It's just really now in recent years that we're seeing the influx of women veterans. And to be honest, I think it's our responsibility as the VA and VA employees to really make an effort to say, we see you, we recognize what you have done and what you've sacrificed, and we're here for you. And I know I can speak for myself and some of my colleagues. We are really trying to do that. And I'm also open for feedback from any of our women veterans. And I will say, I am holding focus groups. I've been holding them quarterly, and they are on culture to elicit some of that feedback and to see, what we can do better, learn more about the experiences of our women veterans, and see, okay, this is what we're doing well at, we'll keep doing that. But then this is where we're not doing so great, and this is where we need to draw our attention.
And on that note, you got to mention that we are on Facebook Live right now, live streaming. So if you want to tune in on Facebook Live, you can see us there. Also, look at our old shows on YouTube. Leave comments. Tell us what we could do better. Tell us what some of the things you want to hear about. And issues like this, particularly women, let your voice be heard. Let us know how we can serve you as veterans serving other veterans, and also what the show can do for you and your community. Krystal, one thing I want to kind of go back to that issue about culture, and that is, so what types of things do we need to do as a veteran community to change the mentality, to change the culture, to be more inclusive?
Mm-hmm. I think first and foremost, just recognizing that women, especially when they're coming to the VA, that they don't automatically assume that they are the spouse, that they are the caregiver. I've had so many women veterans who come in, and it's automatically assumed just by anyone that they're not, that they're coming there not for themselves but for somebody else. So I think that's one. Two, I think to be mindful of what we're saying and how we're saying things. So, at Hines, I teach new employee orientation, and part of my presentation, I talk about harassment and what employees can do, like what they should be looking out for if they see someone, harassing someone else, and how to intervene. And, some of the questions I get is, well, my comment wasn't meant to be taken that way. It was supposed to be, funny or sweet, but it's not, so just because that's how you meant it, if you're not sure, it's better not to say anything at all. Because again, a lot of our women veterans have experienced, PTSD, military sexual trauma, and so you don't know what you're saying, how it's going to be received, and how it's affecting them. And it can be very, very triggering. And then I think the biggest other thing is, and this is, for other males in particular, is that if you see a woman veteran or even a woman being, harassed at the VA, to step in and say something. I have found that, males respond better when another male is intervening as opposed to a female. And I think those things, they may seem little, but can really go a long way.
Wow. One of the things that people talk about, especially in people in your field, they say that women are 3 times more likely to suffer PTSD than men are. What's some of the science behind that?
I'm sorry?
So women are 3 times more likely than men to suffer PTSD. Is that correct?
I'll be honest, I know that the rates are higher for PTSD as well as MST. I just don't know. I'm not recalling the exact statistic.
So on that note, then, so when women come in for treatment and come in to talk about their issues and things, and they've had usually come from a very, very rough place. They've had a rough time trying to get this information out when they're in service, in uniform. Maybe it's suffering from MST, military sexual trauma, or having some type of traumatic event or experience or harassment inside the military. How do you get women to open up and be willing to communicate and share their stories so you can treat them?
Sure. So I will say, here, any patient, when they're coming in for an appointment, we do, and I mean it's our nurses and our providers, we have something called screenings. And so they will ask them particular questions regarding military sexual trauma, domestic violence, as well as depression. And so with those questions, depending upon how they answer, if they screen positive, then they will be referred to the appropriate mental health clinician. So that could be our MST coordinator or champion. It could be just our therapist or intimate partner violence coordinator. And then they will outreach that veteran and then, obviously provide treatment. Now, if something is happening same day during the appointment, like these questions, maybe trigger something inside, we do have same day services available where that particular clinician can be on site and meet with the veteran. Because we never want anyone to leave an appointment, feeling worse than when they came in. And if they need immediate help, we want to make sure that they're getting that.
And then, so now going back to this one question about coping mechanisms, when people are being treated, what are some of the coping mechanisms people can use to to kind of help themselves if they're going through PTSD or suffer some kind of trauma?
Sure. So I will say later on in the coming months, we are going to have one of our mental health clinicians on who can probably speak to this better. But I will say when you're in the moment, just sometimes taking a deep breath, slowing down, and just really noticing your breathing. Also, focus on maybe something that's in the room and concentrate on that. Two, maybe step outside of where you're at. So if you're in a room that you think is triggering, maybe go outside and look at like the grass or, the clouds, something that makes you feel happier. Or call someone. I always recommend who are people of support for you, who are someone that you can reach out to and it just makes you feel safe. And I would say make sure have those people handy, have those contacts, and you can reach out to them. And that, or even play like calming music, or some calming, tones, or, watch something or hear something funny. With our phones these days, there's so many different apps. So it just makes that access so much easier to find something and save something that can help bring you down a little bit and kind of lift you in the moment.
So hopefully with what you give us today, the information, we can get more women into the VA system and get treatment. Mm-hmm. So what's the benefit of, say, going to the VA versus going to a private health facility?
Sure. So I will say two things I think are the benefits. So one, our staff, not all our staff, but we have staff who are also veterans. So they understand. And the staff who are there because they want to be there. If we don't fully understand, we try to understand and are genuinely sincere in the care that we are providing. The second is, I want to say care coordination. I think the VA does a really good job to coordinate care so veterans don't feel like they're left on their own to figure things out, especially when, if you're diagnosed with, something very serious. That is in and of itself overwhelming and complex to navigate. But at the VA, I feel like there's always someone you can turn to help guide you and navigate you to where you need to go. So those, I would say, are the top two things.
Now, for women that are thinking about going to the VA, particularly at Hines or even Jesse Brown, what do they need to bring? How do they prepare themselves for their first appointment?
Yeah, so before anything, and I say this because I've had this happen, the first and foremost is to make sure that you've contacted eligibility first and that you're registered in the system. Because I think that is, we want to make sure you're there and that you have your appointment. Now, when you're coming for your appointment, I think it's very important to, one, write a list or have a list of things that you want to discuss or that are very pressing to you, like the top 3 things that you want to address. And also maybe bring a list of things that you think would be very helpful for your provider to know. That, and then if Hines, I can't speak for Jesse Brown because I don't work there, but Hines is a very large place. And so if you need someone to help navigate, if you've never been there before, let us know and we can help with that as well. Because again, we don't want anyone coming in, especially for the first appointment, to feel overwhelmed. They have no idea where they're going. And we do have volunteers and staff all along the way to help guide our patients. But if you feel like, okay, this might be too big, give us a call and, we can, meet you and then walk you to your appointment.
And then, Krystal, before we go, give us that phone number one more time.
Sure. So my direct line is area code 708-202-2075.
And you just heard Krystal Lynn Gilewski, a new partner of ours at America's Heroes Group at the Hines VA, licensed clinical social worker, psychotherapist with 11 years of experience. Thanks for coming on our show.
Thank you so much for having me. And I also just want to say a big thank you to all of our veterans. We appreciate you, we recognize you, and we're here for you.
This is America's Heroes Group. We'll be right back. Stay tuned.